6:00. And we'll call this meeting of the Wilson County Memorial Hospital District DBA Connally Medical Center Board of Directors to order. First step then is for us to do the Pledge of Allegiance, the Texas Pledge, and then Marcelo will lead us in the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
So, let's pray. Gracious God and Father, thank you so very much for the deliverance that you offer us through your only begotten Son, Jesus. Your grace and your mercy, it abounds. And I ask you, Father, because you tell us that we could come and ask for whatever we need. If we ask in Jesus' name, so it's in his name that I ask for wisdom and for guidance and for insight, Father, for this board and all the staff and everybody that's involved with the hospital. So it's for the healing power of Jesus to be spread out in a very practical and wonderful way. En el nombre de Cristo Jesús. Amén.
Amen. Amen. All right, next up is roll call. Marcelo Lejas. Here. Nicholas Yanisek, absent. Donald Finley, absent. Larry Richardson. Here. Justin Cook.
Here.
Bonna Reed is absent. Tom Miller, present. Allison Lambert.
Present.
All right, we do have a quorum. Next up is the approval of the January 2022 board meeting minutes. Should be attached to your agenda. Please take a look at those.
I make a motion to approve the minutes from January 20th, 2022.
Motion by Allison Lambert. Do I have a second?
Second.
Second by Justin Cook. All in favor? Motion carries. Citizens input. We have no citizen input this evening. We'll move on to item 6, review, consider, and take action regarding any of the following issues. First item up is order of elections. There is an election that is coming up. It's going to be held on May 7th. For purposes of electing possibly 5 directors to the hospital board of directors, if indeed we have opposition. The deadline for filing to be a part of the election is tomorrow at 5 o'clock. So far, we have no opposition, but there could be a line outside the door tomorrow at 4:30. So, don't know. Do we need to vote on this or anything, or do I just need to?
I think you have to sign and just the order of election. It's not you have to announce it, and I don't think it has to be,
I'll take it to the county tomorrow.
so
Is there any, but no vote needs to
no
be
vote
made?
needs to be made.
Okay. Just to informative purposes, letting you know that we will be submitting the order of election for Wilson County Memorial Hospital District for the election to be held on Saturday, May 7th. If, in fact, we have no opposition at our next board meeting, we will sign a cancellation for it, depending on if we have. So I will sign this and get this sent to Kim for the meeting. Just so you know, has everybody gotten all their signature sheets, their applications in? Very good.
We certainly don't need a motion, just to make sure.
Let's make one just in case.
Yeah. There's no harm in just making a motion to
Just
order
submit
the
it.
election.
I
Okay,
make a
just check that
motion
box.
to submit the order of election, is that what it's called?
Yeah.
For the May 7th, 2022 election.
The motion by Allison Lambert. Do I have a second? I'll second. Second by Larry Richardson to submit order of election for Wilson County Memorial Hospital District for the election being held on Saturday, May 7th. All in favor? Motion carries. All right. Next up, item 7, review, consider, and take action regarding the Finance Committee items. First up is the January summary financial analysis. Larry, you weren't here for that, so do you want us to go over this, or do you want to do it yourself?
I've kind of read through this, that's fine.
You've read through it?
Yeah.
Okay, Marcelo, what was the recommendation of the Finance Committee?
Finance Committee recommendation is to approve the January summary and financial analysis as presented, and I so move.
All right, you have a motion by Marcelo Lejas, do I have a second?
Second.
Second by Justin Cook to approve the January summary and financial analysis. All in favor? All right, motion carries. Next up is capital services, or capital expenditure service agreement, lease agreement. First up is Wilson County Election Offices contract. Just to let you know, Larry, this is so that our election can, that Wilson County will sort of help run our election. We don't have to do a separate election for us. We will.
Will be on their ballot.
We'll be on their ballot. We will, yeah, and we will pay for a percentage of the cost of the election if we have candidates.
Right.
It's based on the percentage of the number of candidates that we have.
We know what that cost
The
is.
amount, if I understand, is up to but not to exceed $35,000, which is typically what we have spent on an election in the past. So, what was the recommendation of the Finance Committee?
Finance Committee recommendation is to approve the Wilson County Elections Office contract, and I so move.
A motion by Marcelo Lejas, do I have a second?
Second.
Second by Allison Lambert to approve the Wilson County Elections Office's contract. All in favor? Motion carries. Next up is the Meditech electronic case reporting interface. Would you tell us about that, a little bit, just so Larry can hear about it?
So this is previously we had meaningful use, now it's called PI. It's a national measure that every facility has to do. So we've got a number of public health reporting initiatives, syndromic surveillance, immunizations, electronic lab recording, ELR. ECR is a new requirement that we have to provide this year. We have a Meditech upgrade coming in May. That'll be the coding part of this. We have to have the interface. That'll be the outbound that we send our data. So we send it out to HIEs, the public health reporting agencies. Our data goes out, and if they have data that needs to come back in, we can absorb any outside patient data into our system. So it's a national requirement. We'll have to provide 1/4 of data for this year. So we'll go live in May. We'll build it out in June, then have it ready hopefully from July through the end of the year to actually get our data.
So this is all part of the whole concept of having patient records electronic.
Patient interoperability, so it's us sending data and absorbing data as a conduit at all times happening.
It's a form of continuity of care between institutions.
So,
That was the word I was looking for earlier.
Right.
CCD.
Yes.
Quite honestly, I've seen a lot of improvement over time when going, it's just within Connally, going from one doctor to another, they all know what the other doctor has done. They all know what medications they have, what is happening, so.
Well, that's internally. We still get even external from San Antonio Methodist CCDs that are coming in that we can absorb as a care nurses just to see data. And this expands upon that data set of being 12 data fields that currently get sent out. It's up to about 20 data elements that will now get sent back and forth.
Sounds like a big improvement. All right, what was the recommendation of the Finance Committee?
The Finance Committee, recommendation was to approve the Meditech electronic case reporting interface, and so moved.
All right, motion by Marcelo Layhouse, do I have a second? Second by Justin Cook to approve the Meditech electronic case reporting interface. All in favor? All right, motion carries. Next up is the Abbott RF generator.
We spoke about last month, Dr. Miller came on board as our new pain doctor. He's been in clinic and also doing surgical cases. He's brought on some additional types of patients into the surgery area. One of that is they're needing a radio frequency generator, which is electronic heat that heats up a nerve ending and stops it from sending pain signals. So this is for lower back pain, neck pain, arthritic knee pains, elbow pains, shoulder pains, things like that. So this will be $25,000 for the generator, the stand it's on, and the electrodes that connect with it. $25,000 for the purchase of the device. We've already done 3 cases so far that have already been billed out and we've been reimbursed after under 2 Medicare and 1 Medicare Advantage program. The reimbursement on those procedures it came in at $1,297. Looking at our supplies, our surgery staff, our profit per test is roughly $924 a test. We've done 3 cases in 6 weeks, so 1 every 2 weeks. So we kind of put an expected volume of 2 per month, which gives us a return on investment in a little over a year. What the expectation is, he's planning on getting a lot more of these in, but just based on the volume we've seen so far, obviously the ROI is pretty good on it.
so that's a new machine?
New machine.
What's the life expectancy of the?
So he's used this machine at his New Braunfels clinic that he's had there for at least 10 years. So looking good there. Plus this, if we don't purchase, we have to go to a lease program, we'll pay at a per month or per case to rent it, which would go obviously directly into the profit line.
Yeah. Okay.
And did we rent for these 3?
So we've had the Abbott in a striker model that we've been demoing for the last month and a half for these. So we haven't paid anything toward those.
They let you use it, open your buy it.
Yeah.
So you just got the price down to 24,000.
Yeah. It's about, well, if we do 1 per case, when they bring out 1, it is $1,000 a case.
Okay, so we've done 3.
We've done 3.
Okay, well, good. Good.
All right, what was the recommendation of the Finance Committee?
Finance Committee recommendation was to approve the Abbott RF generator, and make that motion.
All right, have a motion by Marcelo Layhouse, do I have a second? Second by Larry Richardson, to purchase the Abbott RF generator for $25,000. All in favor? All right, motion carries. Sure. Now we will move to item 8, which is monthly, annual, and quarterly reports. And we start out with the annual quality assurance performance improvement plan for 2022, and that's with Gary Williams and Valerie Dickey.
So Valerie couldn't be with us this evening, but Sue Tackett is here. She's our infection control nurse, and also is on our quality team. And so she's going to report off on a couple of performance plans. Plans come to the committee for your approval. The quality assurance performance plan and the infection control plan both were presented last year. We're trying to get back on an annual reporting basis. And so these plans you actually saw it at some point mid last year. There may be changes coming to them later, which we can bring back to the committee, but she's going to speak to that. So, Sue.
Thank you. Good evening. Thank you for letting me join you. Well, I come today, as Gary said, with the quality improvement plan and the infection prevention plan. So, as he said, there's been no changes since you approved this plan last year. These plans are basically about the same. They both talk about the scope of both programs. They talk about in the infection prevention, what type of surveillance that we're going to be doing throughout the year, how we do that data collection, and whom we report to. And then the quality improvement plan defines the roles and the scope of the program as well. So no changes. Changes are forthcoming. So you'll probably see me back here in a couple of months or so addressing you for approval again. So I come to you tonight, Sharks, I feel like I'm on Shark Tank. I come seeking approval of these two plans, please. Thank you.
Did you want to see the infection prevention plan?
Pretty exciting.
Yeah. Pretty much that.
Is it one at a time?
Yes.
And then I would move that we accept the annual quality assurance performance improvement plan for 2022 as presented.
I'll second.
Motion by Larry Richardson, second by Justin Cook, to approve the quality improvement plan as presented. All in favor? All right, motion carried. We also have the infection prevention plan.
You too, isn't it?
Yes, I spoke about both of them.
Yeah,
Yes.
we need to do that.
No changes to either one.
Okay, I'll make a motion to approve the annual infection control plan for 2022.
Second.
Motion by Allison Lambert, second by Larry Richardson, to approve the infection prevention plan for 2022. All in favor? All right, motion carries. Okay. We also have the annual security safety risk assessment plan being presented by Brandon.
All right, so each quarter we run through the security program, we have a software called Nessus, so I've spoken about this in the past, that high usage, high volume, but also government level software. So year over year, between critical and high alerts, so we're about 55% change over last year and 30% in the high. Problem is, each month we're getting hit with additional high and critical alerts. So right now, every month we're getting new vulnerabilities, new 0-day viruses that are being pushed out. So right now our numbers hasn't drastically changed downward because there's new stuff being put out every day to cover new initiatives, cover new vulnerabilities that are in the realm. We got announcement, I guess about 3 weeks ago, of a new software that got hit, which we didn't have anything in our house that was under that vulnerability. The CISA, which is the international security agency that the U.S. government runs, they put out a notice earlier this week of high probability of action taking place with Russia and Ukraine, that they, across all industries having a high alert. So we've, redoubled our efforts to make sure we've got all of our patching done, all of our vulnerabilities that we know of that are patched that we can get done. By the week, we're updating Windows devices. Kyle got restarted the other day without some of his stuff saved correctly. So we work on Kyle's autosave now. But every week we've got devices being restarted or rebooted, which is patching being done. So redoubling every effort we have to make sure we've done our due diligence to make sure we're as safe as possible. Nothing's foolproof, but I think we've done a pretty good job of trying to make sure we have layers and layers of detection and redundancy in place to hopefully stop any intrusion that may occur. So with that, we've got Windows, decommissioning Windows 7 devices. We've only got a few left at this point to replace into Windows 10. Those are standalone devices, standalone systems that are off network. Nuclear Medicine has a device. It's its own contained entity. So we have to update and purchase a whole new Nuclear Medicine platform to get there. So things we've got on the strategic plan to move to, but from a standpoint of security, they're off network, they're standalone, so there's no interaction with our network to provide a worm or a hole into the system. Active Directory, make sure all active accounts or anybody that leaves the facilities has been activated, making sure mobile devices all have patching on them. We've got our tracking, so MDM solutions, so if they go off campus, we can wipe them. Recently we did, I think 2 months ago, we had asked for the board approval to update our switches in one of our clock closets. We did the core about 6 months ago. We're making our way to around our facility to make sure we're upgrading our 10 gig all the way around. Also, I guess again, a few months ago, we talked about multi-factor authentication. So it's an existing VPN structure. We already have VPN. This is a added layer to the VPN. So when you log in, you have to add another PIN. So it's double layer authentication, so that you can't just type in a password to be done. Also encryption on our laptops. We've upped the software we've got to a new platform. So it's replacing the existing platform of encryption. A lot more easier, a lot more durable. And also Sophos allows us, we have it on our antivirus. So our entire scope is under Sophos at this point. So that we can manage a lot more under one umbrella. So all these are, for threat, for safety, for performance, security, all that is, just additional layers we've added on that we're trying to make sure we're safe as best we can. And healthcare is out there to be hit. So we're not out. We don't get out of the limelight very often on this side of the house, at least.
Just curious, we hear about different kinds of viruses and things like that. What is the end goal of these people? Are they trying to hold us hostage? Are they trying to get information? Are they just doing it because they're bored?
Well, I'm not sure if they're bored. It's the money. I mean, they get, there's a lot of money in ransomware.
Yeah.
Healthcare especially, we get held hostage, and in that it's a HIPAA violation. And there's double fold of what we get out of what we can get hit. We lock up, and you look in the news, it's every week there's a entity that's hit that's ransomware. So they locks up their system, locks up payroll, locks up patient records. It's not just a patient that gets hit, it can be our own internal systems where we can't function as a company, from paying bills to paying our staff to accounting to IT to facilities. We've had one where they've locked up an HVAC system, so they had to place us dead at that point. So it's all money. They how much they can get, and they're striving to get more and more. They hit an IT service company about 3 months ago that then proliferated the software out to 100 to 1,000 companies. So that downhill domino effect from one breach hit 1,000 different breaches. And it's you pay or you lose your data. And there's a lot of industries you can't lose your data. You're going to be set back a considerable amount of time. That usually the ransom is less than what your due diligence of having to put everything back together.
But is our data backed up?
We are backed up on an incremental phase. So we have daily backups. We have dailies that roll up into a weekly runs into a monthly, and a monthly that goes out. We've got a year's worth of backup.
Well, I guess what I'm saying, if we got hit by ransomware, how successful would they be if we are backed up? Would we just lose that day's work?
At best, the scenario is, when do you find out? When do you know that you were hit? If most good ransomware will sit on your system, their hope is months, so that when we find it or they unleash it, you've got this. amount of time that you go, okay, I can't go back 2 days and go, okay, you know what? We lost 2 days, so be it. And if you got months sitting back in an archive, but you gotta go back that far. The good thing is we can say if we went back 2 months, we could start back in December 15th. But what are you gonna do from December 15th to February 15th to now of all that patient data? It's not a great choice.
To be proactive and do all these scans and all these vulnerability assessments that they do. And that's why we have afforded the best systems for doing this. Is it foolproof? No. But we're far better than we've been in a long time. I feel confident in saying that. And we're striving to do even better.
We're removing
Anything that may be vulnerable, like you said, the Windows 7, sorry, Brandon, those are taken completely off network. Those are completely off our systems until we replace them. No network, and that's only a few, right?
Mm-hmm. I mean, when we started 6 months ago, we probably had 50 devices still on Windows 7. I think we're down to a handful, and then just because they're what they are. As far as a standalone system, they make that particular service go for that moment, but it doesn't push anywhere or push data anywhere else. The other part of device management, anything that looks external to our network is where the vulnerabilities are. So we're trying to remove everything that really doesn't need to sit out in what we call the DMZ zone of it's in-facing and out-facing at the same time. We're moving most of those items as best we can so that we get down to bare minimum means that's the only places that we can get hit, so that we can then prioritize those as being our defense mechanism.
We have to roll with the times, encryption software, the new VPN with the multi-factor authentication. Those are all standards are out there, so we're moving with the times too, just to make sure. So we know who's accessing from the outside, and we're verifying that access.
And then, I mean, I guess Kyle, you can jump on that, but the multi-factor was in dual with our cybersecurity insurance. So that just helps us know that the cybersecurity insurance we're getting the best we can because we've done all these mechanisms to be as safe as we can.
Do you know how many times we get hit or
Yeah.
have been hit or?
It's by the second.
Yeah.
I mean, because it's your public IP sits out there. Everyone, I mean, we have a public IP that everyone in the world can find. So it's constantly being hit by people, good people and the bad people. Because we do have it coming in for data that we do want to come in.
Right.
Yeah, if you run that log, it's by the minute something's hitting it. Now, you don't know necessarily if it's good or bad. The good stuff we allow through a port, so it comes in, and the bad stuff just hits. It may still be trying to be good data, good actors that are out there, but it's by the minute.
Stay on top of it.
Years ago, the company I used to work for, they said they averaged 450 attacks a day. And that was 10 years ago, so I can imagine it's a lot more now.
Yeah, like I said, it's just people hitting that IP. Like I said, you could have thousands. They get hit. Don't necessarily know what their intent is, but somebody's hitting it.
Do we need to approve this report?
Yes.
All right, do I have a motion to approve the annual security safety risk assessment plan?
So moved.
Motion by Allison Lambert, do I have a second?
Necessary.
Second by Marcella Layhouse to approve the annual security safety and risk assessment plan. All in favor? Motion carries. All right. Next, we'll move to the quarterly patient satisfaction report.
All right, so actually this is a annual report of all of 2021. So just kind of a recap. Now I have to kind of preface this with, we changed how, we had Press Ganey and Viveris that looked at our OR and ER, so we did the switch. I think we talked about that last board meeting. And so there's no OR or ER data in here because we're still in the middle of switching. We don't have that. So what you're going to see today is the recap of 2021 annual for med-surg, okay?
Can I add to that too, Gary? I
Yeah.
apologize. So Libby's not here because something came up for her too, but it's because we're doing the switch too. You won't see a clinic report this month. So we will have by the next patient satisfaction or patient experience, we will have ER,
Yeah, we should have some data.
OR, and the clinic system full report. But we still currently get the inpatient, and so that's what Gary's going to go over. Thank you, Gary.
All right, so you guys are probably getting to be experts at this, so kind of recap a little bit. We look at like probably about 3 major performance type measures, and the main one we like to look at is called overall performance. And so again, we're going to look at just last year, quarter 1, 2, 3, 4. We look at it by quarters. So this kind of gives you an idea of where we were. So N, of course, is the number of surveys that were turned back in. Top box, remember the scoring is 1 through 5, and you only get credit if you answer 5, right? So you don't get credit otherwise. So this is the number of responders that said that they rated us a 5 on whatever the question was. And the percentile rank is where we rate then within, it's almost 3,000 other hospitals that are like size, like type, and everything, the whole big press gaining database. This is how we rate among other hospitals. So you can kind of see we waxed and waned. We ended up the quarter at the 86th percentile with 67.46% of folks giving us a 5 on the overall performance. How did you as a hospital overall, that's one big bucket, housekeeping, nursing, everybody, all included, the food, everything all in one big bucket, how did you rate? And that's our overall performance rating for the year. So, okay. So this is like a graphical, another representation of the same thing. You can kind of see how we got it, how we ended up the year then. This kind of goes back to 2020. But quarter 3, we took a little bit of a dip. I'll speak about that here in a few minutes. But then quarter 4, we ended up there. So, kind of to show, I kind of always like to look at this too, the distribution of responses. So when I say, we only get credit for the percentages that are 5s. Okay, so in the third quarter, this is how many, so these are how many very goods we got, ratings of 5. So we got 27% people that said, yeah, that's good, fair. We got some poors, we got, a little bit of people that said very poor. Whereas in the fourth quarter, we had a few more that said actually we did good, and a few less in the other categories. So of course we want them all here, but I like to see, okay, how many are showing up in the good and the very good category. So one of the other questions that we like to look at is, one of the questions is, how would you rate us on a scale of 1 to 10? So 10 being the best, 1 being the worst, how would you rate us? And so again, this is the percent of people that rated us, gave us a 5, right? Okay, so you can kind of see how third quarter, fourth quarter we rebounded. And then this is again goes on the database for all the other hospitals. It kind of looks like kind of follows suit. Okay. And so then here's the data that goes along with it. So we started out the quarter for this question, the 1 to 10 rating, 93rd, 65th, kind of slumped in the third quarter, and then fourth quarter we kind of came back. It ended up at the 83rd percentile. So. All right, the other question I always like to look at is, the question is, would you recommend this hospital to your family and friends? And this one's kind of surprising, and it always kind of baffles me. You think, well, they say, well, we rate you pretty high as a good hospital, but I wouldn't recommend you to my my family or friends. So we always need to take a deep dive into that and see what that looks. So this is the graphic that shows that, and you can see in the fourth quarter we took a pretty good nosedive. For our would recommend for the top box score and also for the percentile rank. And so this is the data that goes supports that then. So you can see our nosedive here down to the 33rd percentile for the would recommend the hospital. So to do a deeper dive and try to figure out where these numbers are coming from and where we need to make improvements, the questions there's 2 different types of questions. There's what they call the Hcap questions, which are arranged in what are called domains. I've spoken about this before, but you have like a nursing domain, the response of the hospital staff domain. These domains have extra questions inside of them. So there'll be like 2 or 3 questions inside of each one of these. You have your rate the hospital question, you have your recommend the hospital question, you have your overall hospital question, but then these domains also have other ones. So I like to look at that and see, okay, so where are we falling down? So you can look at the fourth quarter and the third quarter, these two compare each other, and you can see which ones went up and which ones went down. And so in the fourth quarter, we actually took a dip in the recommend the hospital. So in fourth quarter, we were 64, in third quarter, we were 70. And the communication with nurses category, we also took a dip. These two categories here, the response of the hospital staff and the communication with doctors, we actually improved. So these two categories we want to look at. And then this category here, we took a dip into, which is communication about your medication. And so I like to go into those a little bit deeper and see, okay, exactly how come we took a hit on those. Okay. So communication with nurses, what does that mean? This is kind of the graphic that looks at that. And you can see the graphic, shows how we did take a slight dip, in our percentile rank and also in our score. So we look at the communication with nurses. This was the third quarter, and this is the fourth quarter. So here's the questions that go with it. So the domain is communication with nurses. The questions are, did the nurses treat you with courtesy and respect? Did the nurses listen carefully to you? And did the nurses explain things to you in a way that you could understand? And here's where the biggie is. This is what brought our score down. Did the nurses listen carefully to you? It went down to the 6th percentile rank. I mean, that's pretty now. It was pretty low up in third quarter, is 20, but we just kept on going down. And when you do a deeper dive into the data, this actually occurred in November. So, and I'll speak to that in a little bit here again. But so these are the areas we're going to want to concentrate. So actually, we did better in the courtesy and respect aspect. So the courtesy and respect, we were at 35%. We went up to 77%. We're like, wow, that's pretty good. But the other categories brought us down. But here was the big one. The biggie was the patients felt like the nurses weren't listening to us. Okay.
Sorry.
Right. So communication about medicine. Let's say, okay, that's another one. And sure enough, boy, we took a pretty good hit on that one. Okay. So here was the deal. So let's take a deep dive into that. So there's 2 questions under that domain. One is, did we tell you what your new medication was for? And did they describe to you what the side effects were? And both of those were pretty low, but again, did they tell you what your medication was? 33 percentile rank, that's pretty low. 60, I'd like for it to be better. But 33, that's 33%, that's pretty low. So I look at that and I go, wow, that's so that's how we ended out the year. So just out of curiosity, I was like, so I wonder what 2022 is looking like, right? So when we see those scores like that, then we get together as a team and we say, "Ooh, what do we need to do about that?" And so we start trying to look at, how do we need to communicate better with our patients? They're saying we're not communicating with them, and so we talk about it in our huddles, we talk about it in our unit meetings. We ask questions about what what's going on that would cause that. And you'll notice that in November was when we really took the big nosedive. In November, right before and right during Thanksgiving is when we demobilized, the state demobilized all of the state or the RMOC nurses. And we had to bring in, to backfill, we had to bring in a lot of contract nurses and one-off nurses, per diem nurses and everything. And it's just been my experience, and it's pretty much across the board, that you don't get the quality that you have when you just have temporary folks come in. And we were doing extra bonuses here to try to fill in. We were just doing everything we could because we still had a high census, but the state pulled out all of our, the state support nurses, which even the quality with those guys isn't all that great either, but that's where we took our hit, was in November. So I say all that, January's data is in, and January shows us at the 99th percentile. So you will see what the quarter looks like, but I couldn't be happier about that. So I think we're off to a really good start for 2022.
What's strange is on that one survey, they ranked the nurses were courteous, and everything.
but they're not listening to it.
But they don't listen.
I know it. I know.
It doesn't make a lot of sense.
I know. Sometimes you sit there and you look at that and you just scratch your head and say, okay, what are we missing here in this picture? You know, so it's a real enigma. Sometimes it really takes a lot to try to figure it out. So this is like our overall. So we go back to our overall performance in January. This is that big scorecard, and so blue's good, right? Red like that, and you'll see that starting off in January, we've got a lot of blue. So we still need to look at. So it looks like our communication with doctors is down a little bit. The hospital environment, not sure exactly. I haven't done a real deep dive into hospital environment, but that one's down a little bit. And something else to do with our doctors, some other questions, we need to see what that's all about. And our overall is down slightly, not very much, 0.37%, but you see a lot of blue arrows going up and everything. So I'm encouraged that we're off to a really good start for 2022. And I always like to share some of the comments. You look at those scores and everything, but then the patients, when they do this survey, they can actually tell you stuff, right? So they get to say different things like, all nurses were very kind and treated me with respect. And then sometimes they name names, Christina, Teresa, they were both excellent nurses. I thought this was funny. My room was cool, exactly like I prefer. Some people say, oh, it's too cold, it's too hot, so that was pretty funny. I can go to CMC because I'm retired military, but I choose CMC instead. I know I'll get excellent care and not be a training case. Dr. Dunn was very concerned, made sure I understood why he was admitting me. Dr. Blond checked in on me, kept me updated. Dr. Moorhead's the best. Here's your staff, very compassionate and caring. Another one about Dr. Moorhead, it was excellent. The nurses were outstanding, the best I ever had. There was usually more food than I could eat. The people who brought it were fantastic. Nurses were very patient and calm. I never felt neglected or rushed. I'm very satisfied with the care I was given. Housekeeping was excellent. And my favorite, the best. Anyway, there you go.
I'm just curious, hospital food used to be kind of a joke.
I know.
Have hospitals in general made a big effort to improve food service?
We do good here. I'm just telling you. The comments,
We have a very good diet.
we do. Yes.
It is good.
Yeah.
It's just those that are no salt, no fat, that they
Bring
suffer,
y'all.
they suffer.
We actually, so she came up with a seasoning that
That you can do.
you can do, so that's actually worked. And if you don't mind, I'll elaborate a little bit here, Gary. It's kind of nice. It's really nice to have the deep dive. And I really appreciate the team. You can see where they deep dive and they figure out where they need to improve, and you can see them bounce back up once they do that. And that's what we need to be.
Right.
We need to be able to resolve issues and fix them going forward. That's really good. I really appreciate that with the team doing that. But just interesting here with the top box score. You see in quarter 2, we were 69.3%. And we were ranked in the 86th percentile ranking.
Right.
But in quarter 4, we're in the 86th percentile ranking, but our score is actually for the top box is slightly lower. That's the competitive nature of this, is we're up against 3,500 hospitals.
Yeah, right.
And so if they score a little bit lower, they're probably even lower than us for us to even get to 86. But that's what comes out in the hospital compare for those kind of issues. There's a couple of things, just watch when he shows the graphs. This one's a 0 to 100. So this has a fluctuation between 63 and 76. It's not, this would be a more
Yeah, I just wanted to show
flatter, but this shows to you that there is a nosedive. So it won't go all the way to 0. So just a few things, but the guys are really, all the nurses, all the nursing leadership, they're really working into this and going into this data source to make changes, and that's what we're about. So I really appreciate all of this hard effort.
Yeah, we do. We do appreciate the effort of the nursing staff very much. This one being a report, we don't need to vote on it, do we? I don't believe we do. It's not a plan. So.
Not a plan.
All right, we'll move on to item 9. It's the CEO report. Mr. Gillespie.
Oh, this is your favorite? I appreciate it. We'll see if this works. No. Okay. Thank you. You can do it. I just want to let you know that we're working towards 3 different. Maybe I should let you do that. There's 3 different up and coming things that we're looking for, for capital purchases, yes. We're looking at HVAC replacement, we've talked to y'all about that, and our surgical floor replacement after our incident in December, and parking lot reseal. We're in the process of putting those out for bid. We actually have prepared to submit for those bids. We'll have to post those in the Wilson County News. We'll probably be coming to you by July in various times with all 3 of these bids as they close. So just to give you some information on that.
The parking lot resale, is that the drainage situation, addressing that also?
Yeah, we're gonna, I think the best option for us, we've talked about it together, might be for a cement right down the middle, just to flow that and have it leveled, if you will, to flow out. I think putting a culvert would be astronomical, so I think the best bet is just a cement flow. So.
On the HVAC replacement, have we determined which direction we're going?
We have that. I'd be glad to share that with you at the next board meeting, kind of where we're headed. We're thinking, I think we're leaning a lot, there is a lot of savings towards chillers, but we'll bring that whole proposal to you as we bid it out, because we'll bid out for both options, and then we'll bring that to you. With the numbers we've been presented, it does look like there might be some benefits to chillers, and so, but we'll bring that to you. Okay? I don't want to make that decision with you. This has been a whirlwind month, but in the last week we've seen 3 physicians, or we're going to have seen 3 physicians. We have Dr. Canteri coming on Saturday. This week we had Dr. Christopher Hawkins and Cynthia Gonzalez last week that came as potential primary care physicians for the future. I do have a couple others that are seeking to possibly join us, and so we'll have some decisions to make as to which direction we go. So I thank Marcella there for helping me out with all the tours and the knowledge of Floresville, Texas. So it's been very exciting. So some of y'all might have seen on Facebook, we just a few months ago we had our first baptism, and here at Connally Memorial, and now we have had our first wedding on Valentine's Day of one of our patients. So it was really kind of exciting. All the nursing staff, I can't believe they had cake, they had balloons. It was very exciting. I went up there and it was amazing. Their whole family joined. It was a wonderful time. Sleep Lab starts next week, right?
Friday.
Friday. This is tomorrow?
25th.
The 25th, next week. That's why I thought. Scaring me. So we're getting that ready to go. We're always talking about IV therapy and taking it up a notch. We're actually getting quite a bit of people that are finding out about us through our advertisements, and we have people from Atascosa County, Beeville. They don't want to go to San Antonio on the north side, and they're finding out about us, and so it's been a really great thing. And we've been utilizing our rooms. This one particularly has 3 rooms. We talked about efficiencies in the past, so in taking care of patients, and now that COVID's going down, having those patients screened and bringing them in, you can really work this process. So great thing. COVID, just to always give you all a little COVID update. So we have all this data. Thanks to Brandon and Melinda and Brett and everyone else for getting these reports. But this is the number of positives that we've seen through the 4 waves. So this was the very first wave. I hopefully don't have to watch my cough. Second wave, last year January, this past July, and the number in January. And then we see those in percent positives. So flowing through. We're back down to 7.3% positive. So I think we just got a report yesterday where all the people that were tested, none of them were positive. Gary, can you please, has there been any updates on, last time I checked, there have been no deaths in our facility from COVID. So
we have no COVID patients.
We've been able to help them, get them over it, and get them home. So that's been a great thing too as well. So we're tracking this. We actually, you'll probably see that I'm stealing her thunder a little bit, but we've developed a process for kind of old DEFCON 1, 2, 3, and 4. We implement certain processes as we see a surge, and so we get that on a daily basis. We have certain numbers that we track, whether they're in San Antonio or within our own system. One of the things is a number of our own employees that might have COVID and be out. At the height, I think we were around 18 of our employees out. Right now we have no employees, if I remember correctly, out with COVID at this time. So, and that's been great.
Is the kind of this Omicron outbreak settling down and slowing down here?
It is. It's kind of funny. We went to DEF CON yesterday, one, and it's kind of funny how our own DEF CON, the state came that day and said, we need a process for retrieving all your state nurses back. So it kind of coincided. So yes, we're seeing it go down. I think the state's going, I think all over the state, we're seeing it go down. And so that's why we're heading, I think we have about a month-long process to
They're
demobilizing all our state nurses.
Yeah, so.
And that's kind of what I was talking about here. As of this morning, there were no COVID patients on the floor. Is there nothing? So we still have no COVID patients as of right now. I think yesterday we had 2, but I guess they've done well. No mortalities, as I talked about. ED, we were in the high 40s a day. We're down to about our normal 30, 31 a day. So that's good, and 0 staff out. I want to remind everybody, we're having the first phase of the vaccine mandate. Our due date is Monday, the 21st. They either have to get us the vaccination card or submit it for religious or medical exemption. So that's coming too as well. We're working through that process. Sorry, I don't know how I do that. Just to give you all, we do need to probably discuss for just a few minutes, bylaws and personnel committee. We did have our bylaws reviewed by a lawyer. I got those back a few weeks ago. I'm presently reviewing them, and I'd like to have one and review with y'all the bylaw changes. I believe it's very minimal, if anything. There is some discussion on capital purchases that we need to be looking towards. Right now, we have to submit to the paper for any capital purchases to bid out publicly. We can look at other processes. We can work towards having an amendment made for our bylaws and our policy to make sure that we at least do 3 competitive bids and up to certain dollar amounts. We'd also talked about attendance within attendance for board members, and we could make some changes with our bylaws. We would have to work with our state representative to amend those.
It's the Enabling Act.
It'd be an enabling act.
Not the bylaws, but.
I'm sorry, it'd be part of the enabling act. But we could then list them in our bylaws too as well.
But what created the hospital district has to be amended for those 2 things, if we want to do that.
And so I'll be working with our new state representative just on some of these things, then to bring back with y'all if y'all want to proceed in that path. March board meeting, I think that's spring break for Floresville, isn't it? Okay. So I was trying to think, there was one other reason I wanted to bring up the March board meeting, and I'm trying to remember what it was.
St. Patrick's Day.
That would be a great day. It would be a great day for us Irish. So anyhow, just to let you know, we had put it in the budget for a merit increase for the staff, and so we had distributed a merit increase. It's an annual approximate number of around $303,000 for all of our staff members. For those of them that reach their height of their salary, there was a merit lump sum, and we distributed about $38,000 to those individuals too as well. So
it's kind of like a one-time sort of a bonus
there you
for
go.
those who have reached the maximum level in their job range. Right?
That's it. Yeah, that's exactly it. So it's been a great year, and I think that the staff needed to be rewarded for that. So they've worked very hard and getting through COVID too as well. So just wanted to share that with you. And so into my CEO.